What's going on, everyone? In today's video, I'm going to briefly discuss why I believe that Xanax in particular is the most dangerous and a benzo that is not discussed enough in regards to the long-term side effects. Not even just that, but the short-term as well. For example, today I was cruising through an article that was talking just the basics about how long Xanax withdrawal lasts, for example. And quoting from this, I'm not going to name the site or anything or the name of the rehab center, but I'll just read this to you real quick. For short-acting benzos such as Xanax, withdrawal will begin relatively quickly, within 6 to 12 hours. Symptoms will generally peak in intensity on the second day, and many will largely resolve within 4 or 5 days. That is a dangerous statement. You might go, why? Well, first off, that might be true if you were only taking Xanax for, a couple weeks or whatnot. But what about for people who take it more than even, I'll just throw this out here, more than a couple months even? What is the dose they're taking it at? I mean, if you're taking more than even a bar a day, a 2 milligram bar, for 2 months even, you're going to have withdrawals. And I'll just tell you this, I'm not going to say 100%, but 4 to 5 days. Is that just talking about the physical withdrawals? Because there's the mental cravings as well. Let's go ahead and just briefly hit on this. And this is, once again, I believe, in my own opinion, if you put a tier together of all the different types of withdrawals of different sorts of medications and drugs and whatnot, I would personally say you could even throw on that list, you could throw fentanyl, you could throw, actually we won't, okay, we'll throw fentanyl on there. You could throw fentanyl, you could throw other opiates or opioids, you could throw stimulants. And what I mean by this is, when it comes to the actual withdrawal, what is the most dangerous? What potentially, if you don't have assistance or you don't know how to go through this or what to expect, why this is potentially the most dangerous, and it's the hardest to potentially recover from as well. So let's go ahead and just jump right into this. I just want to briefly hit on, just briefly, real quick. For example, in Xanax is a benzo. I've done other videos on this before, but just briefly, what it's affecting in your brain, okay? So it's primarily, Xanax is a benzo, and it's primarily affecting those GABA A receptors in your brain, okay? When you're enhancing those effects of that neurotransmitter, essentially, which once again, GABA, it does create a powerful calming effect and a sedative effect, so a sleepiness effect to your CNS, which is your central nervous system. That makes you feel, once again, tired. There's that sedation factor that comes in. You feel more mellowed out. You feel chilled. When you enhance that in particular, why it helps people who suffer from anxiety or even a traumatic event. And for people who take it very short term, it can be very effective for somebody. It helps ease that anxiety, that tension for you. But the problem is long term, when you're taking this, some of the side effects that come with it in particular, which I want to hit on, which I don't think are really discussed enough, in my opinion. So this is what I really want to hit on for you, are some of these side effects that I've noticed from patients in the past as well. First off, when you've been taking this for an extended amount of time, you'll start building up a tolerance. So you'll have to start raising your dose a little bit more. Let's start there. So when you're not taking it, it's going to make it to where you're sometimes going to have worse rebound anxiety. So your anxiety from where your baseline was to wherever it was before taking it can feel a lot worse. That's why you'll get a lot of people who take Xanax who will report once they come off of it, or while they're coming off it, their original baseline of anxiety, is nothing compared to what it is now, and even short term and even long term after stopping. And that's why you shouldn't stop abruptly as well. Some of the side effects And this is where a lot of the dangers come in, not only from when you're withdrawing, but also while somebody is using Xanax. There's cognitive and mood effects. When you're using it, for example, there can be dizziness, lightheadedness, and a lot of memory problems. Uh, a lot of times users will report, and I've seen this in particular with troubles concentrating, in the number one, irritability or changes in mood or even sex drive. Have you ever heard before, I don't know if you've ever seen this, but there are a lot of times people who end up getting trouble for abusing things such as Xanax. They'll say things like, while they were using, they never think about the long-term consequences of whatever action they're doing. If they're stealing something, their rational thinking, feeling like it's gone while using it. And then once they're off of it, they start going back and rationalizing, why did I commit? Why did I do this? Why did I do that? Well, it's because your memory and your cognitive function is impaired. It also can affect your prefrontal cortex. So while you're using it, your judgment, also your amygdala in your brain, you're not, when you're using it, it's almost like, it's not that these parts of your brain are shut down by any means, but when you're using something that is a depressant, essentially, it's going to reduce the function of that. And you feel like, as stated, you kind of feel like the biggest thing is you don't care about consequences. That's the biggest thing. Stealing, you'll hear people who, for example, say when they take it, they black out, or they don't even remember the action of whatever the action was, or whatever they did commit potentially, if they broke the law even. If they did something that was really serious that they normally wouldn't do. It's not only they're under the influence, but also it's that drive of not only just wanting the drug, but while you're using it, those rational decision processes you're used to making on a daily basis go out the window. That's why people also say that it feels like your soul is being sucked away. And you might go, well, what do you mean by that? No, you literally feel like your soul, your spirit it's being dampened. It feels like it's being just pressed upon, and you feel like you're losing control. And that is why I think, in particular, not only just with the withdrawal, but why I believe it's one of the most dangerous drugs to come off of. Not only come off of, but while you're using it, the most dangerous long-term problems with it is you can't rationalize. You're not in the right state of mind. You will make decisions in that moment. For example, even with opiates or opioids, a lot of people can be functioning, and or even when they'll be withdrawing, they can still rationalize. Yeah, if they're addicted to it, they'll do whatever they want for the drug. But there's a whole nother level that comes into it when it comes sometimes to benzos when you're chronically using those, because it affects parts of your brain to where you just don't think of the long-term consequences. I'm not saying with opiates this won't happen, but your rationalization processes are less likely to go on opiates or opioids compared to benzos. I'm not saying people are like zombies if they're using benzos in that way, like they can't. And what I mean by this is they're like, when I said soul sucking and whatnot, I just mean like it's just like their emotions and their internal processing of what's right and wrong. That's what is affected the most. And that's why when somebody's coming off of it, they're not only withdrawing, but they're also really suffering from whatever consequences they potentially committed. And on top of it, a lot of times they don't remember what happened if they blacked out from taking higher doses, because there's a lot of people that are functional on these things. And just because you're functional long term, that doesn't necessarily mean, for example, like you can still go throughout your day, but over time it just dampens on your emotions and your, just who you are in general, your irritability. I really don't think these kind of things are talked about enough. Forget the withdrawing for a minute. I'm just talking in specific about while you're using it, just how soul crushing it can be to somebody while they're using it, because it's like they're losing themselves internally. They might not be showing it outwardly, but inwardly a lot of times this is what's happening. That is the main reason why I feel like a lot of times Xanax, and I'm not going to say all benzos, but Xanax in particular can be so devastating to somebody, not only withdrawing, but while they're using it. That's why you need to taper off of it if you're using it, because it's hard to get off of. It's a long process getting off of the stuff, but on top of everything, it causes damage long term, unfortunately. And I'm not saying it will for everyone trying to get off of it, but just be aware if you're dealing with somebody who is abusing benzos or Xanax in particular, that it's a long process. This is not something that's going to be overnight. And I'm not saying that, for example, opiates and opioids are easier to get off of or they're not suffering as much, but I just feel like benzos sometimes get overlooked because they're accessible to people. They're pretty accessible to people, and also it's like the accessibility, it's there for people, but also it's like people just unfortunately, yeah, it's a control 4, which I think is wild, by the way. I think it should be at least a schedule or control 2 in the United States at least. Because more and more studies are coming out just how damning it can be to somebody. Some other serious side effects, and this is while using it. I've seen, for example, obviously we talked about the cognitive and mood effects. I've also noticed, I haven't really noticed gastrointestinal issues, surprisingly. Obviously with opiates and opioids, when you're coming off of opiates or opioids, big thing, you've been constipated while using, so you will have diarrhea. But I've never noticed any GI changes. Appetite and weight, maybe, but the biggest thing is it's almost like when somebody's using benzos, you can kind of like see it in their face. They kind of, and once again, I'm not saying they look like a zombie or anything, but it's like if you really know that person who's going through benzo withdrawal or using benzos, not even withdrawal, using them, look at their face. Sometimes it seems like their face can be sucked in, not like a meth user or anything, but you can just see that there's something off. Their color can be slightly off as well. It looked like that's another big thing. You can just tell that something's just a little off. So don't be afraid to talk to them about it in a non-judgmental way, because that is something I can say is I think that is actually kind of common. You can sometimes see it if you really know them. When I say soul crushing in that way too, it's just their emotions, their demeanor is off, things like that. Some serious side effects, and this is particularly when withdrawing, if you were abusing it, seizures are the biggest problem. And obviously benzos as well are something that they give somebody when they're going through alcohol withdrawal. It's kind of like substituting a benzo for a benzo, but that's where benzos are very useful. Somebody going through alcohol detox, a benzo is what helps them to avoid seizures, in particular, potentially delirium tremens as well. There's a couple others on here. Liver problems, I've never really seen a problem with. I know that's listed, such as jaundice and stuff. That's very rare. If you were drinking with it, maybe, or if you already had liver problems, processing and digesting Xanax or benzos in general, maybe, but I haven't noticed that. I noticed on here it says eye issues. I've actually heard of people who, when they take benzos, because they have such stress, it causes floaters in their eyes. I've actually heard of people when they're taking benzos that actually they feel like their vision is more enhanced, actually, which is an interesting thing to point out. So vision issues, once again, no, I've actually noticed increased vision for people. But then real quick, I really wanted to hit on as well, and I'm not hating on benzos or anything, I'm just saying it's something that, you know, if you know somebody that is off of them and they're trying to get back on track, applaud them, because it takes time. It does, and it's a long process, but I've seen people who've gotten off of them long term and they're back to normal. It takes time for your brain to recuperate, but they're just not discussed enough, and they're prescribed so easily. But one thing I wanted to talk about as well, I found another study which I thought was crazy on here. I just wanted to briefly hit on real quick, or I guess I already did, where I just wanted to hit on this again. Once again, this thing is so vague, so my fear is if somebody looked up, oh, how long does Xanax withdrawal last? Once again, I said for short-acting benzos such as Xanax, withdrawal will begin relatively quickly, within 6 to 12 hours. Symptoms will generally peak in intensity on the second day, and many will largely resolve in 4 to 5 days. I don't buy that. If you took it short term, maybe. But long term, no. that's what needs to be discussed. So if you're taking benzos long term, it will be way longer than 4 to 5 days. You need to get on a taper plan if you've been taking them long term, and you need to talk to a doctor about that. And also to doctors as well out there. I think one thing, a protocol that needs to go on in the future is if somebody is suffering from something that's super traumatic, obviously a benzo can be very beneficial for somebody short term keyword. But long-term use, if you're getting a monthly script of benzos every month, I think it needs to come to a point to where a doctor is prescribing over time to where they get them to a low dose. I just feel like they should be prescribed as needed at as low a dose possible, and maybe only a 15-day supply, and you get it every 30, because the anxiety that it causes long term is dangerous. And if you can't get your script filled in particular and you got to go without it, good luck trying to work. But more importantly, the chance of developing seizures, big risk. And then if they are abusing it as well or taking it, as I said, your rational processing and thinking over time on these things takes a drastic turn long term, and it won't happen overnight. If you're taking high doses, very high doses, a couple times you've ever taken them, yeah, you'll black out, you might not remember it. But long term, if you've been taking them, you'll notice these memory issues. Like you'll be like, what did I eat earlier today? What did I eat 5 minutes ago, for that matter? Things like that. And then also your your morals. That was something I wanted to hit on. Your morals will go out the window. You will think it's okay in the moment to steal. Yeah. You will think it's okay to steal in the moment. And it's not like, oh, I'm just trying to get to my next fix of whatever it is. It's just, it has this way of how it affects your GABA receptors, and potentially as well, there's another study that talks about how it can affect your dopamine and serotonin as well. Because when your GABA is being affected, just because it's not touching your dopamine and serotonin, there is a compensation mechanism going on to where they are adjusting as well during that time. To where it can inadvertently affect them. But yeah, it's one of those things where over time, your morals, who you are as a person, can be really affected, can be extremely affected, and you'll feel like, and people around you will be like, what is going on? What is going on with this person? Why are they acting so much different? That could be a reason, okay? But I'm telling you though, if that is going on with somebody, if they can get off of them successfully, and they can work some sort of program, and they're exercising, and they're really putting an effort to focus on themselves, because some people can't do it alone. They can go into essentially states of, not a state of where they can't move or anything. I'm not a comatose state. Sorry, I'm not. That's not what I'm saying. They can go into a state though where they sometimes, if they when they're getting off it, they've got really bad side effects to where they can't even really get up and move. They're just kind of locked. They're locked in bed. It's sometimes the same as people who have really bad depression, where they can't. I'm blanking on the word right now. What is the word called? I'll remember after it. But where they're not eating, they're not drinking, and they have to go to the hospital and be assisted for this, essentially, because it puts you in such a state of confusion. And it's kind of equivalent, except it's not like for alcohol, you've got delirium tremens that goes on. But in some severe cases, it can make it to where for people where they can't do it alone. They can't, because it affects them in every way as well. I know that was a little bit of rambling today, but I just wanted to make that video because I think there needs to be way more awareness to where if there's somebody out there who's struggling with addiction, or just trying, not even addiction, you were just prescribed this long term and you're trying to get off of it, or you're wondering, why do I feel like, not even irritable, why do I feel like I'm changing? Like, for example, like I feel like I'm more irritable, I've got more impulse control issues. I feel I'm more susceptible to stealing or doing something very irrational. This could be the reason. This potentially could be. And for people, for example, it's one of those things where for some people it's like, They think, oh, if they're a polysubstance user using opiates or opioids, they're using benzos, they're using this, they're using that, and they'll be like, oh, I think it's probably the opiates because that opioid addiction is a huge thing. But they notice they're like, no, there's still very minimal change after getting off of that. A lot of times when it comes to those memory issues, the concerns of your rational thoughts, it ends up being the benzo. So a lot of people will find once they get off the benzo that a lot of times that there's a huge difference in that the opiates or opioids or the stimulant or whatever it was not the problem. It was the benzo, and that's the medication I was told that wouldn't be the problem by the doctor. And this isn't hating on doctors or anything. I work in the healthcare field. I understand this. It has its uses, but I just think there needs to be more education about benzos out there. Sorry for that rant. I know I haven't done a video in a while, but I just wanted to get that out there for anyone. There needs to be more education on benzos and in particular Xanax. And I think there should be changes in the future, just how it's prescribed in general as well. Love you all. Like, subscribe to the channel. Leave a comment if you've had problems with benzos in the past, or, things such as your rational thinking, or you feel like your morals have been dampened as a result. I'd love to hear some input. Love you all. Like, subscribe to the channel. Leave a comment. Leave a comment. There will be more content coming soon. Have a great week coming up.